All right, good afternoon, everyone. My name is Scott Nass, and as most of you know, I'm a family physician outside of Los Angeles. And until very recently, I was practicing and living in the Southern California desert, about 3 hours east of LA. So a very remote area, and although it's known quite frequently for its being a playground of the rich and famous to go on vacation or a well-known retirement community, there's a large part of the desert that lives with very limited resources, and that definitely applies to the medical situation there as well. And so I was blessed by being a family physician with being able to provide medical services to a large variety of individuals living out in the desert. And one of the challenges, but which was very fulfilling for me, was being able to try to connect them to very important resources that they might otherwise lack. So sometimes being very creative while working at the free clinic, getting screening mammograms or other such necessary medical services. And one of these patients is Justin, and I'd like to tell you about him today. Justin came to see me at my clinic out of the blue. He showed up on my schedule as a new patient, nothing in the computer about him, except that his name wasn't Justin in the computer, and he was listed as a female in the computer. And my nurse did a fantastic job of meeting him and his family at the door, ushering them into the exam room and taking a relevant history around why Justin was there to see me that day. And she'd been working very hard about understanding when to use the appropriate pronouns for someone who might be presenting as a different gender than what's listed on their ID or in their medical record, and was very proud to come tell me that, Dr. Nass, here's another one of your patients. And that was sort of her code just for someone that I took care of that other folks might not take care of in the community. And so she always sort of felt like they belonged to me in that sense because I was there for them. So she was very proud that day to tell me that he goes by Justin, he uses he brought his mom and his sister with him today. And I said, thank you very, very much. I really appreciate you being a part of the team. And put my usual smile on my face, took my sort of stabilizing breath at the door, made sure that I had that positive expression on my face as I walked in the door. But I walked into a very sad room. I could feel it, it was palpable. I had to walk through this sadness to get into the point where I could actually look Justin in the eye as he was sitting on the exam table. Because he was wearing baggy boy clothes, hunched over, looking at the ground. His cell phone was beside of him, and he probably had been tapping on that until I knocked on the door and then politely put it away. Over in the corner was his sister, who didn't really give that much of a care, I guess, about me being there. She had her feet up on the chair, her hoodie on, earbuds in, doing her thing on the phone, and there was Mom sitting with her knees together, purse clutched in her lap. And I felt, this is a family that needs something. And so I always, address the patient first, whether they're 2 years old or 102 years old. And I said, Justin, it's nice to meet you. I'm Dr. Nass. And he mumbled something, polite in response. And I always ask, who did you bring with you today? And he said, sister, Mom. I said, okay, great, sister, nice to meet you. And she indulged me. And then, Mom, nice to meet you as well. And before I could really get that sentence out, Mom, she barely could look at me. She barely could even raise a hand to shake mine. She just burst into tears and was sobbing. And so I paused and started processing, and I looked at Justin to see if he could help out in any way. He just sort of rolled his eyes. Okay, so I looked at his sister. She just rolled her eyes as well. And so I looked back at Mom, and in my best doctor voice said, I'm sensing some emotion here today. I was really disarmed. So she then pulled out a giant wad of tissues from her pocket, and clearly she'd been clinging onto them for most of the morning, and dabbed at her face and blew her nose, and while wringing her hands, she looked at me and said, I'm just so grateful that you're here. And I hadn't done anything. I literally was just there, and that struck me so profoundly. And so I went on to ask Justin, to say to Justin, I'm glad you're here. Tell me more about yourself. And he gave me the usual, 14-year-old boy, I'm okay, sort of answer. And I said, well, tell me about why you're here today. And Mom and sister occasionally, but mostly Mom chimed in, and they had that typical Mom, interaction where he would correct her or have her correct herself. But the long story short was that they had been seeking services for Justin in Los Angeles, which is, again, 3 to 4 hours away with traffic, because they couldn't find anyone in the Desert Valley to provide what they considered compassionate and competent care. They weren't able to find someone who would talk about the issues he was facing, where he's a boy, but labeled as a girl, and other people see him as a girl, was having issues at school. And I validated their concerns that, wow, that does seem awful difficult to have to drive all the way to Los Angeles to get care, and I'm glad I could be here. Let's talk about what I can do for you. And so Justin, with a little coaxing, finally went back and told me about himself. And early on, about 3 or 4 years old, he remembers being a boy. Even though his mom was forcing him to wear pretty frilly girl clothes and wear pretty little shiny girl shoes, and they were buying him Barbies and other toys to play with, he knew that wasn't right for him. And mom and dad knew something wasn't quite right either, but 12 years ago this had been, there wasn't really a name for that, especially out in the desert community, and in their network, their church network and school network. So they really didn't know what to do. But over time, Justin became more and more frantic about wearing girls' clothes and refused to go to church, which was very much a family activity that they enjoyed together for all the years before. He began becoming depressed. He began missing school more and more by just not being able to get out of bed. And this was even in grade school, and certainly now into his 8th grade year was becoming worse. He started cutting in middle school as a way to deal with the frustration and find a way to have pain that he could control. And he very readily began to talk about suicidal thoughts. He never attempted suicide, but he was very frank about having these conversations with his sister, who shared that she was there for him during this time. And it only became worse within the last year, because when he came to see me for the first time last summer, he had just gotten a period for the first time. So you can imagine a little boy for the first time getting a period, completely unnatural for him. He was wearing a binder on his chest because he had also started to develop additional tissue there, and it was becoming a chest that didn't belong to him. And so as he sat there telling me the story, he was constantly sort of pulling at it because he had outgrown the binder that he had. And his parents didn't really know how to support him. Where do you go buy something like that? They really didn't know. And so they really were desperate for care locally. And so I said, you know what, let's get started. Let's do this. And it became a group effort, but we started him on medication that stopped the periods, that stopped the development of breast tissue, and actually helped a little bit of it recede. He was still having significant depression issues, and so we made sure that he was still plugged in to mental health care. He'd been going to counseling, but now we really were able to form a more directed plan with him. And so, that's Justin's story. And my story around Justin is that, as a child, I also struggled with my own identity. What would I want my hair to look like? What clothes did I want to wear to look cool? Who were my friends going to be, this group or that group? We all have this universal struggle with who we are coming up as children into adolescence. But certainly with Justin, he had another layer on top of that altogether. And while I couldn't understand exactly what that felt like, I certainly made myself available to listen to him and to listen to other youth who came along after him once they heard that I was willing to sit there and listen and talk to them and their families about these things. Now, in medical school, I learned about transgender health, and I became very interested in what this means to be transgender and what it means to go through life having people look at you and judge you for something that you aren't, and realize that there really is such inequity around health for transgender persons, and really decided that I was going to help fulfill that significant need that was out there. And so I looked for mentorship early on and really developed a practice coming out of residency, really incorporating healthcare for transgender adults for the most part. Again, there weren't a lot of kids where I was training. But now in the desert, suddenly here I was the person providing this service. And so I looked around and thought, well, surely there's somebody else doing this. Well, we didn't have any pediatric endocrinologists. We didn't have any other primary care providers or pediatricians providing any of these services. We had some counselors, but no really social support services. Even the nonprofit organizations that work with the school system or the transgender community at large, none of them had sort of health and wellness programs around supporting these youth. And so right around this time, literally 2 days after I met Justin, the call for applications to the Leaders for Health Equity Fellowship Program came through my inbox in a Beyond Flexner newsletter. And I thought, this is how I'm going to help Justin. So I was very excited, and but one of the issues that I found early on was, in medical school I learned to try not to be paternalistic with your patients, to try to never really be prescriptive, even though doctors prescribe things all the time. Don't be prescriptive with our recommendations, with our plan. It really should be about finding where the patient is and meeting them where they are and really engaging in shared decision-making with them, their family members, whoever else they feel is a part of their healthcare team. And so I'd long tried to practice that, and I still practice that all the time and find myself being a little more prescriptive, a little more paternalistic than I would like. But certainly I do my best to model that for the residents and medical students that I teach. But one of the things that I didn't connect was when I'm reading research, I always read about these really famous or important researchers from UCSF or Harvard who've gone into a particular community or begun working with a particular group of persons and produce this great body of evidence, statistics, and data and recommendations. But I never really thought about, was there a right way to do that? But what I gathered from that was that there was one way to do that, and that was for me to be the good doctor and to drop into a community and help decide what's best for them. Because in a way, we do that in the exam room, even though we try not to. We're still the ones coming up with a lot of ideas to try to help engage patients in their care or do what we think is best for them. Bottom line, even the best shared decision maker, I think, has to stumble through that. And so I developed my project initially from that perspective. I was going to help them being the transgender and gender expansive youth in the Coachella Valley there in the desert. But then I was introduced to the leadership curriculum in January, and Kate Hilton and her team really gave me what I call a brave new lens for looking at doing research and engaging with communities and working and doing community-based projects. And that brave new lens is community organizing. And so what I realized very quickly was that my project was entirely from the wrong perspective. It was all coming from me, and that was inappropriate. As much as I wanted to help all of these patients that I had come to know and love, I could do that, but in a different way. So no longer was I going to look down at this community and do a needs assessment and ask them questions and bring them in for interviews and figure out a way that I could make them better. I was going to find a way to drive the community from within. And I didn't know how I was going to do that first. And so Abel, who was our trainer for our small group, on day 3 or 4, we were talking about how we were going to kick off this effort. So I'd already come up with ideas about, how do I engage them as a group? How do I engage adult stakeholders who see themselves as mentors? How do I make all these pieces fit together? But the question that day was, how are we going to have this kickoff? And this was a very contentious question in our group, because I said, I don't know what transgender youth will get excited about. He said, well, pick something. And I said, I don't know, that's why I'm doing this project. He said, pick something. And I said, I don't know, a slumber party? He said, yes, they're gonna have a slumber party. Well, I learned very quickly when talking to transgender youth about slumber parties that they have no interest in slumber parties, right? But his point was important, right? That I had to think about something that they would enjoy. And so that really began my struggle for getting into this community, because I don't even know what any old kid wants. From 2 to 22, I'm a little distanced from that. And certainly, individuals living in various parts of the desert who, just because they have this one piece of identity in common doesn't mean they're all going to come together for a slumber party to watch horror films or something like that. But what I did realize was, no matter how I did manage to find entry, into the community in terms of partnering with them, working outside of the community was not an option. I was never going to reach meaningful, sustainable outcomes if I was the doctor trying to do something from the outside looking in. And so I did a lot of outreach initially, building my network, talking to the adults in the desert who had already been doing a lot of great work, either in general working for safer schools, working with transgender adults, working to build the youth mental health community in general there. And they all were very interested in being a part of this project, but they had long been operating in silos. And they were all doing similar work, wanting to help the same population, but their silos never really had connected. And each of them felt that they knew best for the youth of the desert. And generally they would reflect on, well, such and such tried this project once upon a time, it didn't work. That'll never work, or they were crazy for trying that in the first place. And so it was really a big fact-finding mission for me to feel out, the environment there. Who was I going to be hoping to engage as leaders in this distributed leadership model that we had learned so much about? And so what I found, that me stepping in as another adult who'd been operating in my own silo really wasn't the trick initially. But when I leveraged the story of Justin, when I was able to put a specific face and talk about the very specific tears that his mother cried and the very specific challenge they had trying to get to Los Angeles every week, missing a day of school on top of the days he was already missing from his depression, from having the periods he wasn't supposed to be having, that was more motivational. It wasn't perfect, but I moved the mountains ever so slightly. And what I was able to really, I think, impact was bringing up this shared purpose. It wasn't just, I'm doing my work, I'm doing my work, I'm doing my work, but really, there is an opportunity for us to do something good for this community at large. The challenge remained, though, as I was beginning to start this snowflake, the adults were still a little hesitant to look at things from a community organizing model in terms of actually working with that community. They were a little hesitant to let the kids be in charge, as they would say, right? And I'm trying my darndest not to call them kids as I stand up here in front of you today, but as they much prefer the word youth. But then, as I was starting to make some inroads there and really start the focus to be on how can we help the community at large, find their own power and harness that to create change, if they saw change was necessary, right? That was something I was assuming from my perspective. I had some own personal transitions in my life. I wound up moving to Los Angeles, again, 2 hours away from the desert, 3 to 4 with traffic, and that became more of a challenge than I realized. And I reflected earlier that my personal failing forward had to do with my thinking that I could maintain ownership of this project being so remote, and that unfortunately didn't quite work. And so I was able to find a surrogate leader in one of our residents, Dana, who was very engaged in taking care or partnering with my transgender patients in their own health once I had left, with some mentoring and coaching around the medical aspects of their care. But really didn't see herself as a leader or community organizer, or even really think of that as a role that she could grow into. And what over time I helped her realize, I think, was that just by being a physician in the exam room, she is being a leader. Just by speaking to her peers about transgender health and about taking on a project like this, she really was leading in a sense that she was demonstrating her ability to really affect health equity beyond just the exam room. And that's one of the things I like to portray in terms of what's possible for family medicine. So working with Dana over the past couple of months, she's a busy resident, but we have come up with some next steps toward being able to have a kickoff of sorts in the spring, at the beginning of the year, really to convene the youth together, sort of separate from the adults, because what we both realized is that going through the adults to get to the kids, the youth, isn't going to be the right way, right? We have to start where we really want to start. And so that is another thing that I think I really learned and that Dana was really able to grab onto. So looking back on the year, I reflect now as an organizer, which is really amazing. I had done a little community organizing training in the past around marriage equality in California. That feels like forever ago, but never had really been in a leadership position to be able to try to affect change in a community that was very much other to me in the sense that I wasn't a part of it, but that I felt very close to because of the significant need that I was seeing day to day in the exam room, and I was getting in the frantic phone calls from parents, that I was battling with the insurance companies who were refusing to provide puberty blocking medicines in a patient that I couldn't really say was having precocious puberty, which they were the only thing they were indicated for, but in California you can get them anyways. It was constantly writing letters, making phone calls between Vera, my fantastic nurse, and I. So when I do look back, I realize that never again will I look for what a community needs. I probably will have my thoughts initially that will prompt me to do more thinking about that being a community of interest that I might be able to help, but how can I help them? During this time, I've been able to provide care to even more transgender and gender expansive youth, because when you're that lone voice in the desert, people are listening for it. They're desperate for it. And by that, in a sense, I almost felt like I was organizing just in the exam room, really helping individuals to try to find that power within themselves. And everyone, so different. Some who are just voices for the cause that I know that we can harness moving forward. Others that are in a deep shell they formed around themselves that really need to be pulled from it. But they're definitely a representative sample of the youth out there who are desperate, I think, for opportunities, and whatever those may be. I want them to be able to tell me about that. Been able to grow my own network in terms of the adult stakeholders, and now that I'm no longer actually providing direct care to these individuals, I'm outside of that power differential of physician and patient, and so now I have a whole new batch of resources that I can work with and really pick their brains and do researchy kind of things like focus groups and one-on-ones with these youth who won't feel that they're in a position to have to do what the doctor says, and that was one of my hesitations early on. And looking forward, I'm glad that Dana is around as a leader to be able to move this project forward, to be able to be there for the community that I can only remotely be there for. I am keeping some ties there, and I'm always available as a mentor. But certainly, as I do look to the future, I think one of the things that I'm most grateful for is that this young individual, this Justin, who had talked about killing himself and was continuing to hurt himself on such a regular basis, I'm grateful that he will be there in the future to lead me as we move this project forward. Thank you.